Hi, I'm Jordan and this is my demonstration video. I have one audience member with me. So today I'm going to be talking about my specific purpose, which is that I will inform my audience on how to use a goniometer to measure the knee. I'm also going to be talking about my central idea, which is my audience will be able to understand what a goniometer is and how to use one. So did you know that there's geometry for the body? We have angles all within our joints and we measure those by using a goniometer and getting the degrees of our ranges of motion. I'm going to be doing my demonstration video today on how to use a goniometer to measure the range of motion of the knee. Currently, I'm a student physical therapist assistant and I have been taught how to use a goniometer to measure someone's range of motion in their joints. In physical therapy, this is an essential tool and we use it every day in the clinic. At some point in anyone's life, they're going to have some physical ailments, aches and pains. This could be due to trauma, such as a sudden injury or post-surgical. It could also be due to degeneration that comes with age, such as osteoarthritis or compressed discs. Almost everyone's going to have some sort of rehabilitation or physical therapy within their life. So today, I'm going to be showing you how to use a goniometer for the knee, and this is to become familiar with the process so that you have an idea. I'm going to go over the goniometer and the different parts of it, do a brief anatomy review of the lower extremity since we're going to be measuring the knee, and I'll give you some landmarks that we'll use in measuring, and also how to measure and how to read and interpret our results. You will all be familiar with the goniometer after watching my video, so let us begin with an overview of the goniometer itself. First, in order to understand how to measure, you must understand the parts of the goniometer. So there are three parts of a goniometer. There is the proximal segment, also called the stationary arm, since it is attached to the body, which is this middle part, and it doesn't move independently from the body, whereas the distal segment, or the part furthest from the trunk of the body, moves independently from itself. So since there are three parts, it means that there's going to be three different landmarks that we need to line up the goniometer with. So as stated by Norkin and White in their Guide to Goniometry, goniometry is a term that is derived from two Greek words, gonia, meaning angle, and metron, meaning to measure. Therefore, goniometry refers to the measurement of angles. Some goniometers are going to have a full circle body, like this one, whereas others will have a half circle body. This is to help with the ease of measuring for the examiner. Goniometers also come in a variety of sizes. This is due to some joints being larger than others. So a large goniometer like the one I showed would be used for the hip, whereas a smaller one, like this one, would be used for smaller joints like within the wrist. Any size can be used for any joint, but it all comes down to practicality and accuracy. Yes, a large goniometer could be used for the wrist, but is it going to make the examiner feel awkward or uncomfortable when they're measuring the patient? Or is it even going to make the patient feel uncomfortable? We definitely don't want that. So it could affect the measurement, and we want to make sure that we're getting the most accurate measurement possible so that we're treating our patients effectively. Overall, knowing your tool makes you a more competent examiner, and when you can explain the usage and the mechanism of your tool, it helps your patient to trust you more and puts them more at ease. Now that you know the parts of the goniometer, I will go over the parts of the body that you need to know in order to measure their range of motion. So let's go into a brief anatomy review. The human body has plenty of distinctive, prominent landmarks that are used for goniometer measurements. So we're going to take a brief look. So first, we're going to start with the femur. This is the longest and strongest bone in the human body. It is also referred to as the thigh bone. So if we're looking at the topmost part, or the proximal part of the femur, also known as closer to the trunk, we see the greater trochanter, which is a prominent feature on the outside. So if you look at if you're touching the outside of your hip, and you're rotating your leg back and forth, you can feel it actually glide over your finger here. So that's going to be a feature that we need for when measuring the knee. Some other more distinctive landmarks on the lower extremity would be the fibula, and this is the outermost smaller lower leg bone, and we have the fibular head, which is towards the top of it's towards the knee, And the lateral malleolus, which is the bottom of the fibula, that makes your ankle bone. So if you take a look at your ankle, you have two bones on the outside. So if you're looking at the outermost part, that's the lateral malleolus, and the innermost part is the medial malleolus. Medial malleolus referring to part of the tibia, and the lateral refers to part of the fibula. And then we also want to be aware of the joint line with the knee. So that's where the tibia and the femur meet. They complement each other very well because they have similar shapes. And this space in between is referred to as the joint line. So when we're looking for our lateral epicondyle of our femur, which would be the outermost part of the knee, we're going to be looking for the joint line and then using our finger to move up and to find that lateral epicondyle. So this is what it's going to look like when we're looking for those landmarks and doing our measurement. We're going to be trying to find the greater trochanter at the top of the leg, the lateral epicondyle at the side of the knee, and the lateral malleolus at the ankle. In order to measure the joints of the human body accurately, you must be able to know your anatomy. You also need to be able to visualize the inside out because we're going to be working with real patients, not just a skeleton. So now we need to put the goniometer and the landmarks together. So let's get to measuring. Accuracy in lining up the goniometer to the correct landmarks will yield the most accurate results. This will only help your patients in the long run because you want to make sure your measurements are accurate so that you're treating them the most effectively. I will show you the landmarks on the patient, how to line up the goniometer to the landmarks, and how to read and interpret the results. We'll be measuring for knee flexion, which is how much the knee is able to bend on its own. So first, like I mentioned, we're going to find that joint line between the tibia and the femur. So we're going to go right to the side of the knee here, and we should be able to feel a space between the tibia and the femur. So if you move your finger up, you'll be able to feel the lateral epicondyle of the femur. That's going to line up with the axis of our goniometer. And then we're going to be bringing the proximal arm, this arm, closer to the trunk. That one's going to be pointing towards the greater trochanter. So you can see these lines on each of the arms. We want to make sure that we're going straight through the middle of the greater trochanter and through the middle of our lateral malleolus, which can be easily found just by looking at it. So we're going to take our axis, line it up with our lateral epicondyle, and then the proximal arm is going to line up with the greater trochanter. And then I'm going to have him bend his knee in without letting the foot come off the table because that would involve some hip motion. We just want knee motion here. So go ahead and bend. So see how I can move the moving arm with how the knee just bent? We want to make sure we get everything aligned again. Make sure the axis is over the lateral epicondyle. Make sure this proximal arm is in line with the greater trochanter. Make sure this is in line with the lateral malleolus. So once we get that, everything lined up, we want to make sure that we pinch the moving arm to the body so that we don't lose our measurement. We'll take a look, and he has about 140 degrees of knee flexion. So for every joint, there are normal ranges that everybody should be within. As far as for knee flexion, normative range would be between 130 and 140 degrees. So he's right on the higher end of the normal range. If he were to be below normal, that would be considered limited or hypomobile. As far as being over normal, that would be considered hypermobile. Here, we were able to tie everything together and use our goniometers to measure a patient's range of motion of the knee, specifically with knee flexion. Now you have a basic understanding of how a goniometer can be used within a patient's treatment as far as addressing detriments in their range of motion. In conclusion, there's a lot that goes into just a simple action. You have to know your tool and how to use it appropriately, know your anatomy and be able to apply it to a real patient and not just a skeleton, and you have to be able to read and interpret your results to treat the patient accurately. This is only meant to serve as an introduction and tutorial of goniometry. I don't expect anyone to become an expert following this video. However, now you have an idea of what it takes to be a physical therapist. If you ever need to attend PT yourself, now you can always refer back to that time that you watched a demonstration video of goniometry. Thanks for watching.